You are listening to Therapist Unplugged for straight talk on life, relationships, and mental health. I am your host, Laurie Poole, licensed professional counselor with the Montfort Group in North Dallas. Each episode will feature the unplugged views of guests and fellow therapists as we navigate hot topics, therapy trends, and the world around us. Well, hello, everyone, and welcome to Therapist Unplugged. I'm your host, Laurie Poole, licensed professional counselor in Dallas. And today I am delighted to introduce our guest, Dr. Richa Mittal, who I have crossed paths with in my own weight loss journey and midlife everything. And so I am so delighted to have Dr. Mittal as a guest today to talk about women, midlife, weight gain, hormonal shifts, all kinds of things that those of us who've gone through that period of time understand pretty well. Dr. Mittal is an internist, a diplomat of the boards of obesity medicine and lifestyle medicine, a menopause society certified provider, as well as a culinary coach. She provides comprehensive and personalized preventative health, medical weight management, and menopause care to patients in her practice, Radiant Health, Weight Loss, and Wellness. She is a strong advocate for evidence-based weight wellness, lifestyle medicine, and women's metabolic health during all stages of life, especially the menopause transition. She educates through her social media platforms and midlife women's blog, Life Fully Nourished. Welcome, Dr. Mittal. I am just so excited to talk about all of these things today.
Me
Thank you.
too. Thank you so much for having me.
Oh, it's my pleasure. So tell me, what drew you to working with midlife women around weight and hormone health?
It started out more preventative health in terms of metabolic health issues. I personally have dealt with them, have a very strong family history of heart disease and diabetes. And I
Hmm.
used to work on the inpatient side in the hospital, and it was very much, it felt like very important work, but it was also very transient. And I wanted to be more on the preventative side of things. And then, in my 40s, I entered perimenopause myself. And I think as I shifted in my own life, my practice also became more interested in that side of things as I worked with women and realized what a big change that is that occurs for women in their lives.
Well, do you hear things like when women come in to see you, will they describe it as like something just feels off or I don't feel myself? And if so, what do you think they're actually describing?
Yeah, I think they're describing a lot of different symptoms, and it can really vary woman to woman. I think the common ones are sleep problems, brain fog, not feeling like myself, weight gain is one that they notice a lot. Their labs change, like maybe they were kind of going along, and then all of a sudden they got told, like, hey, you have high cholesterol or you have high blood sugar. So it can really vary quite a bit. And, I think that a lot of times they're just like piecing it together and it just never really was evident to them, like, hey, this could all have kind of a commonality to it.
Right. And it's so interesting too, because I think at some point you can feel as though something's not right, but I don't exactly know what it is. And then I remember in my own experience going in to see you and finding out, oh, I had this, and this contributing to how I felt. And it was a relief in a way because there were physiological sources for how I was feeling, and so that made a huge difference to me. I'm wondering about hormonal shifts in perimenopause and menopause and how that affects like weight, energy, mood, tolerance, those things that seem to surface.
Yeah, it's a big piece of the puzzle. And that's why I felt like, as I started working with women, I became certified in menopause care because I was missing that piece. And of course, I could direct them to get help elsewhere, but it plays a very big role. And how is because number one, it's not like it declares itself. So, women are kind of going along, and then all of a sudden they're experiencing different symptoms, and things aren't working the way they used to, or maybe the things they used to do to maintain weight, or especially midsection, maybe changes in their
Yeah.
body,
Yeah.
sleep problems, stress, mood, how we cope with things. These are all very closely related to our hormone health. What makes it hard is that perimenopause is this very vague, years long,
Mhm.
could be 7 to 10 years long
Yes.
time frame for women. Of course, we all know, like, oh, okay, one day we lose our period. Well, the last day that you have a period, you don't even know that that's going to be your last one. And then
That's
12 months from then, it's called menopause.
yeah.
So perimenopause is tricky because it's not that there's a simple solution like, hey, check my hormones. A lot of people come in thinking, hey, I'll just ask for my hormones to be checked. They're all over the place because it's a roller coaster time. Your brain and the ovaries are communicating, and there's all sorts of things happening in terms of your estrogen levels and your progesterone levels. And it's not as easy as just doing a blood test, but also all of these fluctuations affect mood for a lot of women, especially women who've had a history of maybe depression or anxiety in the past, or even postpartum depression. I've had postpartum depression, and I know that it wasn't in my control. And during perimenopause, a lot of those things that were maybe well controlled or hadn't showed themselves in a while can start to play a role. And of course, how we feel mentally impacts everything else.
Absolutely. Absolutely. I'm wondering, something that I hear frequently is the things that worked for me in my 30s and 40s often stop working. Like I'm just gaining weight more easily. I can't lose the weight as easily as I used to. And people get very discouraged and hopeless about that. Um,
Mhm.
why do you think that happens? Is that related to the hormonal shifts with
Multifactorial.
okay.
Number one, as far as the hormone shifts are concerned, estrogen drops and the fact that it's kind of a roller coaster does lead to potentially emotional lability and problems with mood. Also, can lead to hot flashes. And of course, that can have an impact on how a person sleeps and how they feel in terms of their quality of life. Brain fog, cognitive function is also impacted by the drop in estrogen. And then,
Yes.
as far as weight is concerned, of course, all those things contribute to weight because you don't feel good. But also, the drop in estrogen impacts where we carry body weight. So, even though if you look at the SWAN study, which is a study looking at women over the spectrum of perimenopause and menopause, and is looking at health across the nation, it's not that there's necessarily just weight gain during that time, but specifically we're carrying weight in our midsection area. So women may notice that their body shape has changed, but that type of fat, unfortunately, in our visceral fat compartment is also much more negative in terms of its impact on our long-term health, like heart disease risk, diabetes, and blood pressure, and all of that.
What is visceral fat? Just for our listeners, so we have a sense of what the challenge is to
Yeah, so we carry fat in different compartments in our body. We have subcutaneous fat, which is right underneath the layer of our skin. And oftentimes, when people gain weight there, they may notice it might bother them, but that compartment of fat is not as dangerous to our overall health. When we think about visceral fat, it's the fat that's around our intra-abdominal organs, around our liver, our heart, pancreas. And it's not really just measurable always by the visual inspection of someone.
Mhm.
So they can be in a quote unquote normal BMI range and be carrying more of the visceral fat because it's internal. So some of the testing that we do is one called a bioimpedance scale that we use in our practice. It sends an electrical current through. You can now get home scales that measure that. Or a DEXA scan can also look for that type of fat. And visceral fat leads to issues with cholesterol, blood pressure, insulin sensitivity, meaning diabetes risk,
Yeah.
and cardiovascular heart attack and stroke risk long term.
So that's the kind of fat you don't want to be carrying around your midsection.
Correct. And then with the hormone changes, if there's sleep disruption, if there's change in mood, maybe we're eating excess calories, maybe we don't feel great, so we're not doing our resistance training. And, both men and women, starting at the age of 30, start to lose muscle mass. Well, if you're not feeling great, you're not necessarily in the gym, and therefore you might lose muscle mass faster.
Yes. Oh, I've experienced that. I understand that. Tell me something, in your practice, how do you approach weight loss without blame or the diet culture? Like, what do you think your approach is that maybe is different than what other folks might experience in another practice?
I think it's so important to take a step back and honor the fact that our bodies can change over our lifespan. We're
Mhm.
not going to look like always like we were in our teens and 20s.
That's
However, I think loving ourselves and coming from a place of self-compassion and not judging is a great start to change because some factors are in our control, some factors are not. We can't hate ourselves into shape, that just doesn't work. And diet culture is about restriction. And I would love for women in this phase of life, and myself included, like I deal with the same challenges that everyone else does on some level. Of course, everybody has their own journeys. But if we can come from a place of body recomposition as a priority and health habits as a priority, looking at our health not just by the measurement on the scale, the
yeah.
full weight number, but looking at how is our muscle mass doing? What is our visceral fat level? How do my labs look? Am I fueling my body with the food that it needs to build muscle? Am I expressing love to myself just through food or alcohol? Or are there other ways that I can show myself love and compassion? Then we can come up with more of a reasonable weight management goal that takes into account much more than just the number on the scale.
Yes, and I think that especially for women, and I don't know if you notice a difference between men and women in your practice, but I think that women can have a whole negative rhetoric in their head, a whole narrative that's critical, that is blaming, that feels shame, all these negative emotions. And it can kind of spiral into a negative cycle where it just, well, I might as well just eat what I want because I'm never going to get out of this hole anyway.
Yeah, it can feel pretty futile. I would say number one, again, build a narrative in your own mind too that fosters that type. What would you say to your best friend? What
Hmm.
would you say to your daughter? You probably wouldn't say the stuff to them that you say to yourself. I think,
Exactly.
that's a big piece. Recognizing that there's this kind of as we have grown up in our lives and even now on in celebrity culture and social media, there's a lot we're told a lot about what we should be doing, what we should look like, and those standards are not always necessarily realistic. And we don't know what cost that person has been paying in
Right.
terms of disordered eating and frailty to achieve some type of worth through thinness. So I think there's cultural shifts needed, shifts in our own mindset, celebrating what our bodies can do, not just what they look like on
Yes. Yeah.
surface level.
Yeah.
And, I think that I want to break the cycle for future generations to know their worth is way more than some, silly standard that some man came up with. Sorry.
No. How do you, can you talk a little bit about GLP-1 medication and hormones and, how they might work together in your practice, or when does sort of one approach work with one patient and maybe something a little different with another patient? Because the GLP-1 medications, as you know, have been very prominent in the press. And some people are, a little reluctant or they don't trust or whatever. Anyway, I would love to hear your opinion and how you practice that with also now hormone treatment.
Yeah, so, nothing is just all good or all bad. I think it's important to recognize that it's a medication like any other medication. It's not a quick fix. It's a tool to be used along with all the lifestyle changes and foundational health habits. And there's probably a lot of people on them that shouldn't be. And there's a huge amount of people that probably would benefit who aren't. And that's because the medication gets stigmatized. The use of the medication gets stigmatized. It's not to achieve a number on the scale, but it's a medication that helps metabolic health, meaning it helps your blood sugar control. They lower blood pressure and cholesterol. They can help with fatty liver and reducing risks for heart attacks. Yes, they help with food noise and
Yeah.
reducing appetite and thoughts around food, but they need to be dosed carefully in the right person with proper monitoring because the side effects can be pretty nasty.
Yes, they can.
And I think that sometimes people feel like, oh, this is just the way it's supposed to work. And it's like, no, no, we don't really need you feeling like crap. You need to be able to eat and feel your body. But to answer your question about the hormones, you know, um, even though the hormone changes contribute in midlife to weight gain, there is not really good science or data to show that hormone replacement leads to weight loss. And I know that's kind of shocking to some people because they think like, oh, I'll just go on hormone therapy like estrogen and progesterone and I'll lose weight. And it doesn't work that way. But what it does do is two things. Number one, it helps you feel better so you can have quality of life and do the things that you need to be doing. Number two, we have some small observational studies now showing that GLP-1 medications in tandem with hormone therapy, women lose more body weight when they combine them rather than just GLP-1s alone. So that is something for us to consider. And I would say that hormone therapy is so that you can have quality of life, so you don't have as many hot flashes,
Mhm.
your improvement in sleep. There is some evidence that it helps to lower visceral fat, so that is important.
Mhm.
And then GLP-1 medication, whether to use it or not, and then how it's prescribed, that's a separate issue. And I think that they're very important medications in our toolkit.
Mhm.
They're not the only medication. We do forget the fact that many of us were practicing medical weight management before GLP-1s came to the scene. So,
Right. Yes.
we do have other options, and that can be sorted through working with an obesity specialist. But I would say that they're a pretty great tool when used in the right way.
Okay. Well, it seems to me it's made that the GLP-1 medications have made a huge change for many people in a very positive way. Um, I'm wondering about, your practice and how you approach these options with patients. Because I get the sense that it's much more individualized based on what the patient needs, what the goals are, what the presenting symptoms are versus, okay, you want to lose weight, you want to feel better. Here's the script, here's what we're going to do, that it's really very tailored to the needs of the patient.
Absolutely, just like any other medical concern. But, I think when it comes to weight management, there's this sometimes mentality of number one, just diet and exercise. When do medications come into play? Well, medications come into play if, first of all, someone has been in the cycle of losing and regaining. We need to think about why that's happening. There's certain mechanisms in place in our body that work against people in maintenance so that they're not able to maintain the weight loss. Body sees that as a threat, the body weight loss. Number two, did they take drastic measures that weren't sustainable, right? Or maybe they have hunger and a derangement in the appetite and satiety related hormones that are going to be addressed through medication. Do they have medical issues that are going to improve with body fat loss? And there are quite a few conditions like sleep apnea, fatty liver, blood pressure, type 2 diabetes, pre-diabetes. Then we know, hey, we're starting to stack up here and the benefits outweigh some of the risks for this person. When we're choosing medication, we're looking at medical issues, but we're also looking at amount of weight loss desired. And that's where even surgery can come into the picture. If someone has more than, 100 pounds, or maybe maybe for them, they need to be in the category of 40 to 50% weight loss,
Mhm.
that's going to be more achievable through bariatric surgery. But medications have a certain amount that we on average see in terms of the studies. Of course, people are different. We want to think about existing medications they're on. Are there contraindications to the different medicines? So
Mhm.
it's a much more complicated picture than just, sending a prescription. But the bottom line is, a tailored approach allows for making sure you're not going to have side effects or contraindications to current medications. And number two, you have the full spectrum of options, and one can try one and move to another. It's not set in stone.
Right. And I think the other piece of it too, which we haven't talked about it yet, is nutrition
Oh,
and
yes.
the impact of proper nutrition, tracking what you're eating from a point of view of how much fiber and so on. Can you speak to that a bit? Because I'm really curious about that as it relates also to mental health.
Absolutely. We are what we eat, right? It's like kind of that simplistic term. But even for people using GLP-1s, one of my major concern is malnutrition. So, the point isn't to starve people, right? So
Mhm.
we want to make sure that whether you're using medication or not, you're building a foundation of, again, fueling your body with what it needs. And mood-related issues, of course, you can speak to that more. There's a lot of science around mood and nutrition too. And we want to, number one, give our bodies adequate nutrition, meaning we need to be getting protein to maintain muscles and enzymes in our body. We want to include healthy fats that we need. Of course, fiber is a big focus that we talk about. A foundation of fruits and vegetables that nourish our body, maintain adequate amounts of antioxidants that work in our body to help, lower inflammation, but even in the gut. So the connection between brain and body appears to exist in the gut. We have all these trillions of bacteria that live in our gut. And that gut microbiome, if you will, is responsible for the production of neurotransmitters like serotonin, dopamine, that are involved in our mental health and emotional well-being. And when we eat foods that give that bacteria, again, all the foods I just mentioned,
Mhm.
the nutrition, reducing alcohol, maintaining physical activity and sleep also has impacts on our gut microbiome.
Mhm.
It helps to build that foundation. And when we're in a weight loss journey, we want to move our mindset away from restriction and more on how can I have a more balanced diet approach that makes sure I'm getting what I need, but not being in a calorie excess or maybe being in a deficit during the time when we're looking for body fat loss. And then eventually in maintenance, being able to eat enough to fuel our bodies.
That makes me, it just what strikes me about what you've just said is what a profoundly different approach that is to weight loss and to well-being, that it's the overall well-being, radiant and optimum health, right? It's not just about losing the weight, it's having balance. Are you sleeping? Are you exercising enough? I had a conversation last week with a psychiatrist and I asked him, what's the one thing you would recommend in terms of fighting against depression and anxiety? And he said, absolutely 150 minutes a week of physical exercise, whatever that means for you. It's
Yeah.
it's inexpensive and it's something everybody can do. So you put really good balanced nutrition in tandem with that to feed the microbiome that you're talking about. And then the whole mind-body connection gets snapped to it, it gets recalibrated.
Yep. And I would say, I love that they brought up movement. I would say sleep to me. Personally, I've struggled with it with hormone changes.
Yeah.
For midlife women, that is so hard. And when the sleep falls out of the routines or it's really hard to achieve, well, of course, it affects what we eat, whether we have the bandwidth to exercise, to prepare meals, what we may reach for instead. So I would say if you had to pick one thing, there was just one thing, maybe I would start with sleep and then let the other dominoes fall into place.
Okay. So let's start with sleep. I think that's a very good, I think that's a very good place to start. Maybe where most people will say, "Ah, I'm always tired. I never feel like I get enough sleep." What's one thing you wish women knew before they started blaming themselves about how icky they feel?
I think that it's not as simple as eat less and move more. And that's a narrative that we've all been told. And of course, eating less and moving more or not eating in excess is important, but that's such a simplistic view. And it doesn't take into account genetics and mental well-being and all those foundational, health parameters that we're talking about today. And, our bodies are in an environment, if you will, that's what's called obesogenic, meaning we're sitting too much, we're not sleeping, we're not moving. Maybe we're surrounded by, high calorie food that makes us feel good in the moment, but it's not nourishing. And, it's not as simple as just telling someone, hey, just don't eat as much. Like, there's so much more to it.
There's so much judgment about obesity. It seems to me that there's a kind of disdain. And when you say, eat less, exercise more, that's something that's brought up for me is I think, man, we point to someone who's carrying a lot of weight and we make, oh, they must be lazy, they eat too much. There's these just disparaging social comments that are made about obesity. And I
Mhm.
think it's through practitioners such as yourself and more education and awareness that hopefully we can get away from that because it's just not that easy. As you've said, there's many factors that contribute to improving our lifestyle and our overall well-being, especially as we're living longer. My goal is to live well into my 90s and have most of those years the best ones.
Yes, absolutely.
Um, So I really appreciate not only your practice, but your approach and your messages to people because, and especially women, because I think we can be very, very hard on ourselves. And the harshest critic is often in our head. And if
Absolutely.
we can find ways to change that and to link emotional, mental health, physical health, spiritual health, all of that converges when we think of living the best versions of ourselves.
I love how you put that.
Dr. Mittal, if our listeners would like to contact you or learn more about your practice, where can they find you?
So, on all social media platforms, Instagram, Facebook, YouTube, TikTok, it's at Richa Mittal MD. My practice website is myradianthealth.com, and I can see people all throughout Texas. And regarding the blog that you mentioned in the beginning, Life Fully Nourished, it's at richamittalmd.com.
Beautiful. I love that. Well, thank you so much for your time today. This is going to resonate with a large number of our listeners, and I love your messages. And I have benefited from being a patient in your practice and can speak fully to the benefits that I've enjoyed. So, thank you so much for your time today, and I look forward to talking with you again.
Thank you so much for having me. Take care.
The Montfort Group aims to provide a serene, calming setting where you can feel challenged, supported, and motivated. Our skilled therapists bridge specialized backgrounds and varied philosophies together to create one unified strategy. Rather than steer you away from your own natural abilities, we help you maximize your unique strengths to uncover the boldest version of yourself. We do not view a broken history as the end of a story. We see it as an opportunity for a new beginning. To learn more about our practice and how we can help you, please visit us at themontfortgroup.com.